evening, everyone. It's a real privilege to be here talking about my research tonight. Really what I want to do tonight is just take on provide you with a couple of landing spots, if you like, of my journey in my work in this area since 2008 in the area of domestic and family violence, specifically related to refugee communities. How did I become involved in this area of research? Well, I guess I've had a broad interest in the area of domestic and family violence for quite a while, since I undertook my honours in 1992, so it goes back to the last century. But I've also had a lifetime commitment to social justice. The other sort of prong to that is that I really also believe that research should involve those who are impacted by its findings. So an opportunity arose in 2008 for me to work with African communities, with the state government through the then Family and Domestic Violence Unit, and Assets, which is an organisation that supports torture and trauma victims here in Western Australia. And the African communities wanted to do something to address domestic violence. So domestic violence was a self-identified issue for them. So naturally I jumped at the opportunity. So what I want to share with you today, as I said, is a snapshot of my research with refugee communities in Perth, and how in particular one research finding sort of grew and diversified. And certainly there's lots more findings, but I guess they're for another evening. So just a bit of context. I guess during 2015, domestic and family violence really reached into the consciousness of the Australian community, I guess ignited in the early parts of the year by Rosie Batty being named Australian of the Year. During the year we had extensive inquiries undertaken in a number of jurisdictions around family and domestic violence, including the Royal Commission into Family Violence in Victoria, and the report for that, which is multi-volumes, has just been released. And also in September of last year we had the Prime Minister's announcement, notably Mr Turnbull announcing that violence against women is one of the great shames of Australia. It's a national disgrace. So it was really brought to prominence in 2015. So what do we know about the prevalence of domestic violence in Australia? Just some very brief cherry-picked stats, really, and these come from the 2012 Personal Safety Survey undertaken by the Australian Bureau of Statistics. They found that 1 in 4 Australian women had experienced emotional abuse by a current or former partner since the age of 15. And 1 in 6 Australian women had experienced physical or sexual violence from a current or former partner from the age of 15. And additionally, about 879,000 over that number of women born overseas had experienced violence, physical and or sexual, since the age of 15. So from that latter statistic, we're not able to identify which of those women were actually refugee women. And that's a problem that's riddled throughout the literature. And that's one area where actually the research that we're undertaking is making a difference, trying to tease out refugee groups from other migrant groups. And it's really important because although migrant and refugee women may share common experiences, for example, things like unplanned departures from their country, limited access to healthcare, education and support networks, if we designed research that sort of blends the two, it really makes delineating the issues from those from refugee backgrounds or those from war-torn areas or conflicts really, really difficult. And it's really important that we're able to do that for a number of reasons. We have a long history of resettling individuals and families from who are fleeing persecution, war and violence and who seek refuge within our borders. And we also resettle relatively large numbers. Indeed, since 1947, we've resettled over 800,000 refugees. And I would suggest that that number is going to increase, partially in response to the current humanitarian crisis in places like the Middle East. So my research has been with African communities, but the findings that we found, what we found, and the way that we have undertaken the research, I actually think has salience across refugee communities who are now residing in Western countries. So in terms of the groups here in Australia, the African groups, domestic and family violence has been an issue of concern for them for a number of years, and they had many attempts to deal with it from their own community, which were largely ineffective. But in 2004, there were deaths some of the African communities because of domestic violence, which precipitated a partnership approach between the government, the communities, community agencies and the university here, and that partnership is still flourishing today. So the communities wanted baseline evidence to inform how they moved forward around the issue of domestic violence. So we undertook this research entitled Exploration of the Nature and Understanding of Family and Domestic Violence within the Sudanese, Somalian, Ethiopian, Liberian and Sierra Leonean communities and its impact on individuals, family relations, the community and settlement. So it was really a comprehensive study and was the first of its kind in Australia. So what did we find? What we found really was that domestic violence is felt deeply within the communities. The quote from a woman in our study suggesting that domestic violence is the real torture in human life, I think is a really powerful statement, given particularly their experiences of war and displacement and torture and trauma that they've experienced. And I think it also attests to the devastating nature of this issue in their communities. Now, as this diagram suggests, domestic violence is a complex issue in refugee communities. The context in which it is perpetrated and experienced is multi-level, from the individual to the relationship to the mesosystem and the community, all in the context of Western society's non-acceptance of domestic violence, its construction as a crime, and in the context also of Western social and legal systems that really seem quite alien to many new arrivals in Australia. It's even alien for many of these groups to understand that the state would have a role in their family lives. So the desire from the communities, as noted, was really to do something about the issue, and to this end they wanted the results of this initial research to inform interventions to address it. And that's what I want to share with you now, but to point out that this is very much community-driven research. They were in charge of how we went forward. So developing and implementing appropriate interventions for domestic violence is difficult in mainstream communities, but in refugee communities we have the added complication. We have the significance of torture and trauma resulting from refugee and settlement experiences, and also often a reluctance to disclose the violence. And it's all the more important that when we address domestic violence that it does come from the communities themselves, because interventions that they have had a role in developing will be less likely to be perceived as Western ethnocentric or imposed from the outside. And certainly underpinning all domestic violence interventions must be the safety of women and children. And there are assumptions in some quarters that concerns around women's safety that exist in mainstream communities are not present in refugee communities. And I just wanted to assure you that they are present. And safety is certainly a top-of-mind concern there. But it does add a layer of complexity when you have sort of mainstream agencies really scrutinising any intervention that is put in terms of safety. So what this initial research made clear was that our challenge was to find appropriate ways to respond to the unique circumstances of those from a refugee background that take into account the intersections of culture, trauma and uprootedness, while at the same time honouring cultural differences and, importantly, challenging the violence. So it wasn't an easy task. So what did we do? The Healthy Relationships for African Families model, which is known as HRAF, was developed, once again, partnership with the communities. An initial program was funded by the Office of Multicultural Interests, and in that program, community members and leaders who were often approached by community members for support around domestic violence from 3 African communities were provided with education about the dynamics of domestic violence, Western responses to it, and supports available. So then they could then educate their community members about the issue more effectively. And that was piloted in 3 communities, as I said, and evaluated. And as a result of that pilot, the program was amended and funding sought to roll it out more broadly. And what I have up here is the final model of HRAF. So what was it, what underpinned it, and what informed it? Well, it was underpinned by a human rights perspective, and it was designed to be ethno-specific. So what the model did was it embedded the empowering of influential community members to start discussions about domestic violence in their own language and in their communities to assist those communities to express their concerns. So what we know is that information that is presented in this manner is accommodating to language, and it's actually respectful of culture. So it was considered that the receptivity of the messages was likely to be enhanced. It was also considered that this model would lead to an increase in the understanding of domestic violence in a Western Australian context, and so there would be increased opportunities in the community to identify solutions. So HRAF recognised that many community members from the involved communities preferred to, and they actually did, seek support and information, at least initially, about domestic violence within their own community. And it also recognised that misinformation and confusion did exist in communities with refugee background regarding the laws, the services and the practices in a Western context as it relates to domestic violence. So HRAF involved working with community leaders in communities and was focused on what was termed community conversations. So if we have a look at this slide, we can see that HRAF was based on a train-the-trainer model, community educator model. There were two projects that we ran. One was for 2 years and one was for 2.5 years. One with 3 communities, South Sudan, Liberia and Ethiopia, and the other one with 5 communities, Somalia, Burundi, Congo, the Guinean community and Sierra Leone. So what we did was we trained community leaders, 17 of them across the 8 communities, and then they in turn trained 50 community educators. Now the training was over an extended period, 6 to 7 weeks, 1 full day per week, so it was quite a commitment from these people, and it was facilitated by a range of individuals and agencies, including specialist multicultural domestic violence agencies, the Department for Child Protection and Family Services, WA Police and Legal Aid. And the topics that we talked about were about healthy and unhealthy relationships, about responding to domestic violence in a Western context, and supporting and referring victims and perpetrators of domestic violence. So the manner in which that training was delivered actually enabled what I would consider non-negotiable issues, including things like the imperative for these people to refer to external agencies should an issue present that was outside their scope of appropriate response, and they could be organically introduced and addressed in a culturally secure manner. Community leaders and educators were also provided with skill development in group facilitation and provided with a session on strategies to use as a community educator, and also when facilitating those community conversations. Also during the early part of the training, the participants were introduced to the community conversation model in preparation for those community conversations that would follow. So those community conversations were about domestic violence and related issues, and they actually ensured that a larger number of community members were actually included. And one of the advantages of this model was that information about domestic violence was able to be disseminated to community members themselves, and through community conversations reach deep into the communities. Well, so what? The approach that was taken with HRAF, so it was about community development and participatory education in tandem, is argued to promote leadership and empowerment. And so we would argue that increased visibility of the community leaders and the educators in the community and their responsibility that they took for assuming provision of information about domestic violence actually provides evidence for both community development and community empowerment. And that sense of confidence, I believe, is evidence of the positive power of community engagement as a core strategy to address domestic violence in refugee communities. So looking forward, we do believe that a community resource utilised for HRAF, so those trained community leaders and educators, potentially remains an underutilised and under-recognised vehicle for sustainability of programs in the communities. And I would argue, and there's actually literature to support this, that they remain among the best agents for grassroots change around domestic violence. Education is inevitably part of this grassroots change, and HRAF provided a balanced information to them that was relevant to the community's social, political and economic realities, and was delivered through community leaders and educators to maximise transference into the community. So when we can create an environment in which people from a refugee background can address the issues of domestic violence themselves within their own communities, communities' receptivity to the information provided is usually enhanced. Why? Because it minimises perceptions that the information presented is based on Western-centric ideologies. Also, information that is presented in a positive manner and reinforces community values, for example, healthy relationships, may be more effective than that which is perceived to be confronting and aggressive, and especially that which ostracises men. So training leaders and other respected community members to be educators, as was the case with HRAF, providing a level of sustainability that I believe really augurs well for developing a cadre of community members to address domestic violence education and prevention in the community. So just some concluding comments. Important to note that when we're talking about domestic violence intervention, one size doesn't fit all. Responding to domestic violence in refugee communities requires much more than tweaking mainstream responses. It requires a different approach. The main point is that the HRAF model, which has been evaluated as successful, is very different to interventions that you might see in mainstream communities. Our next project is to develop best practice principles for interventions for perpetrators of domestic violence from a refugee background. And what we find may be very different to such interventions that are currently being delivered. So we now have 2 evaluations across 3 projects about the salience of this model in terms of knowledge outcomes, and we're hopeful that the impact of this kind of model could reach well beyond the issue of domestic violence.